I think one of the basic things that I'm seeing is that insurance companies will cover social workers, but they won't cover psychotherapists for psychotherapy, right? And so that already is a barrier for a lot of folks. I mean, there's some great social workers who are doing practice, but a lot of them work in organizations where they're not in a private practice, right? So right there, that limits that. And then how many of them are Black? That may limit that pool as well. So that's the first point of access that I'm seeing. And then also in terms of how much they'll pay out, right? If you have great insurance that really, the organization has really advocated and they recognize the need for mental health services. I've had clients who they can come as many times as they want, no problem. They'll cover pretty much 100%. And then on the flip side, you have clients who are like, okay, it's $300. Well, essentially, that is only two sessions, essentially, right?
It's like, hey, intake, and then boom, one session.
That's maybe, it, right? And I mean, it puts a weight on the therapist, right? And I've had clients who approach me and they have said, I only get this much for the year. I really need therapy. Any way we can work it out. And I mean, if my sessions are typical $160 a session, let's just say, right? I've had clients where I was like, okay, we'll work with your insurance, which essentially is like, I'll charge you $35 a session, right? So it creates that imbalance, because if this was all that I had as my revenue stream, how is that practical?